Living Well, brought to you by Christus Cabrini Hospital.
Dr. Dasai joins us. We are visiting Christus Cabrini's emergency room. You are an emergency room physician here. The flu has hit central Louisiana. What information are you going to arm us with today?
Sure. Well, the flu is very common. Flu season is typically from November through March, but December, January, February are the months where we see the highest rates of influenza. Influenza is a virus. Anyone is contagious or susceptible to getting the disease. And most of the symptoms that occur with the disease include fevers, headache, body aches, and some of your cold symptoms, runny nose, sore throat, and cough. Some of the length of span that the disease occurs is usually 2 to 5 days.
And that's total misery, isn't it?
It is. It's pretty miserable for most folks. Now, if you've received the influenza vaccination, that might curtail some of your symptoms. It might lessen the severity of the disease. It may also shorten the disease if you're likely to get it. But most folks that have the influenza vaccination are less likely to receive the actual influenza virus. And if they do, they get over it pretty quickly.
Once we know that we have the flu, are there medications that we can get our doctors to prescribe us?
There are. Folks that are at high risk for developing complications from influenza are the ones that most doctors are definitely going to treat. And the people that are at high risk for developing complications include children under the age of 5, adults greater than the age of 65, anybody with any kind of chronic disease such as lung disease, COPD or asthma, heart disease such as congestive heart failure, kidney disease, diabetes, anyone with a transplant surgery is going to be at high risk for developing complications such as pneumonia or dehydration.
Okay, and then most of us just need to stay home, take care of ourselves, take care of your small children. At what point do you decide that I need to go to the emergency room?
Sure. Most folks, it's going to be difficult to determine that. You're usually going to feel so horrible that you're going to want to get seen for it. If you're at high risk for developing complications, you definitely need to get seen by your doctor. If you're unable to keep fluids down and you're feeling like you're having some trouble with your breathing, you're having trouble getting your fever to reduce, you definitely need to get seen. But common treatment for the flu include drinking plenty of water to stay hydrated, taking an over-the-counter pain/fever reducer such as Tylenol or ibuprofen to keep the body aches and the fevers down, which will also help you feel a lot better.
For more information, call 318-445-9006.